Dr. Chris Snyder's been with us. We want to give you a chance to weigh in on this as well. Thank you again for sticking around. Appreciate that. So, really, can some of this be that the UTIs are becoming resistant to the antibiotics?
Antibiotics in general, with overuse, can create resistance. So there's, in fact, many of the drugs we used 20 years ago for treating UTIs, the quinolones, were clearly changed in the last 2 decades to being very resistant, especially in a hospital setting where we have high doses utilized, et cetera.
Wow.
So we look for that, but we're able to define that. We just have to have the urine cultured so we can identify that. So we actually use a roadmap, might you say, to treat bacteria. So when we collect a urine from women or men, we look at the bacteria and we can define whether it's resistant or not to a certain drug. So it's important to get those things identified. UTIs are a little bit of a challenge because the expectation's been for years that we just throw antibiotics at it, but that's really not appropriate.
Yeah, and so we're talking about food and its impact. Do certain foods really affect whether or not you get a urinary tract infection?
Anything you put in your mouth is going to create a change. So I always use pool water as an example. We like to keep our pH just right on target. Helps our chemicals work right. Well, the urine and the blood and everything else also have pH changes. So the acid or basic environment can create definite better medium for bacteria to grow. Sugar is also another one. If you have too much sugar in your system, diabetics for example, they tend to urinate out sugar in their urine, and it's a great medium for bacteria to feed off of. So there's a significant benefit to understanding those things before you throw antibiotics at. There's also other the symptoms of a UTI are clearly, frequency of urine, burning, etc. Right. That's not always an infection. There's a lot of other causes for that. Postmenopausal women, it can be vaginal dryness. There's a lot of different things that can create those problems.
But not just women.
No, absolutely not. So men are much lower incidence, and you always have to worry about sexually transmitted diseases also. Those are significant.
Okay, right.
So that is clearly one of the things we have to rule out. But again, if you culture the urine and evaluate a patient appropriately, you can define the therapy better.
Again, another thing that if you're having trouble with it, talk to your doctor. It's very important.
Thank you for your insight.
Take care
Absolutely.
All right.
We got to get you back in here again.
All right, good.
Appreciate it.
All right. See you next time. And to read more about Peninsula Regional Medical Center, just go to our website, delmarvalife.com. And if you have some questions you'd like us to ask, you can message them to us on Facebook, send an email to comments@delmarvalife.com, or just give us a call, 443-880-9116. Remember, we're going to make sure you remain anonymous.